Nearly 1 in 10 Singaporeans who have suffered a heart attack didn't have typical risk factors like diabetes or hypertension. They're also younger and have an 80% higher risk of death than those with risk factors. That's according to a local study which involved more than 8,000 participants. Tan So-hui finds out more from this first-of-its-kind study.
34-year-old Zhao Chun was playing football 2 weeks ago when he suffered back pain and breathing difficulties.
I mentally not really think it's really that serious, but yeah, he's really almost lie down on the floor and a lot of sweat. So I also a little bit panic. Then we call ambulance.
At the hospital, doctors found that he had had a heart attack. It was a shock for Mr. Zhao as he has no family history of heart disease.
I never smoking and do more the activity and the soccer and
eat healthy also.
I don't know why.
Results from a 10-year study by the National University Heart Centre found a growing proportion of patients having heart attacks do not have standard cardiovascular risk factors. These include diabetes, high cholesterol, or high blood pressure.
So those without risk factors, which generally are younger patients, they come in with a more severe form of heart attack. They have less comorbidities or past medical history, and yet they also have a higher risk of death.
Possible reasons include a delay in diagnosis by doctors.
But it's not totally bleak for these patients. They have good survival after being discharged from the first admission of the heart attack. Doctors say early detection is important and not to ignore the signs of chest pain or breathlessness.
The problem comes when the diagnosis is missed, both in terms by the patient, that the patient doesn't present early, and also from the clinician. When looking at a patient, it may seem like the patient is of a very healthy lifestyle, very healthy profile, and they may not be able to identify these patients. And so further attention is really needed to address this issue.
The team is looking to conduct another study in about a year to look into non-standard risk factors such as obesity, fatty liver disease, and sedentary lifestyles. Meanwhile, Mr. Zhao has recovered after undergoing 2 surgeries. There will also be further studies to learn more about his condition.